First thing we're going to do is get it in, and we're going to look at the area up underneath your kneecap, because looking at your X-ray looks like you have some arthritis up there.
I would agree with that.
Yeah. So there we go. It's just going to be one stick. Okay. So now that we're in the knee, we pull the needle part back, because aside from me being a nice guy, I don't want to mangle your knee. So we're going to put a little bit of fluid in to help clear it up. But up above is your kneecap, and it should look smooth like a ping pong ball. But you see how it's irregular, and you see how you got some flaps there. Now the good news is it's not kind of bone on bone, so it's not as bad as your other knee. Now what we're going to do is we're going to slowly, but yeah, don't you bend it. Just let it rest.
Let you handle it.
Yeah. Mm-hmm. Okay. So to the left there is a lot of inflammatory tissue, that pink tissue.
Yep.
So whenever you tweak your knee, sometimes that's how your knee goes on strike. It gets inflamed and irritated. Now we're going to come down a little bit lower, and we're going to look down at the business part. So there's your ACL, and looks good. I mean, with a mechanism of injury that you talked about, sometimes you can tear an ACL too and not notice it. And sometimes what we do with this is we can take a needle from the opposite side and go in and localize it for touch. So if we're not sure whether something's torn, you can feel it that way. We don't need it for you, but that's a way of doing it. Now we're going to look towards the inside of your knee, and that's the part that's your medial meniscus there on the inside. And we're going to put a little, I'm going to grab your leg here, and I'm going to put a little tweak on it. Let's bend it down. Keep it straight if you can. And now we're looking all the way to the back of your knee. So remember I was talking to you about the two different types of meniscal tears.
Yep.
You have, it's degenerative, but I don't see a flap where it's a mandatory need for surgery. Now what I'm going to do, just to be sure, is we're going to take a peek through that side, because arthroscopy is all about angles, and if we
through the medial side.
Exactly. Yeah. So everything else in your knee looks fine, but I just want to make sure that there's not a sneaky tear there all the way in the back of your knee.
Got it.
So it's just going to be one more stick. There we go. And now we can see from a different angle, and that's the posterior horn there. Now I'm going to squirt a little more fluid in there and make sure there's not, you see how that's a little tricky looking there? That maybe a flap tear back there.
Does the fluid open the joint up?
Yeah, and it just clears the view. Yeah, so you do have a little tear back there, and then some inflammation. But I would tell you that if this doesn't bother you, it doesn't bother me.
Right.
From a surgical standpoint. So what we're going to do is I'm going to inject a little cortisone in there, because that inflammation we showed you, hopefully that calms down your level of pain and discomfort. So when you have your golf trip in a couple of weeks, I don't want you slicing one into the woods and grabbing your knee.
Blaming it on the doctor,
me.
right?
Yeah, okay.
Now, based on what you've seen, Does it appear to be a candidate for the viscose treatment at a later date?
Perhaps at a later date, but definitely not now.
Not now. Okay.
So one thing that's nice with doing these injections with the scope that's in there is you can see it go right in. So
get it right on the spot
yeah,
too.
So there it goes. So all right. Look at the sponge. So basically, what you have is you probably, strained it, irritated it. Your medial collateral ligament has a little looseness to it, but it's not anything that needs surgery. And by being able to move your knee, by being able to look at it at different angles, this gives us a lot more information than we would get from an MRI.
Right. You can see it.
Yeah. So what we're going to do is I'm going to let you put your leg back up on the table. And I'm going to have Jamaria hold a little compression on that and put some Band-Aids on and then have you come back across the room and we'll talk about a game plan for this.
Sure. Awesome.
All right?